Thank you very much. Thank you all so much. Adam, thank you very much for a very kind and warm-hearted introduction. I'm so happy to be here with all of you. I met some of you last night at the reception at the Renaissance, and it's really an honor and privilege to spend today with all of you here. I am truly impressed by the diversity in this room, people from Russia and Germany and Switzerland and Mexico and Austria and all over the world. So thank you all for coming to Paris this weekend and for sharing your time with me. So today I'd like to slides got ahead of me there. Today I'd like to share a bit about Prodigy-5 and why I think it will be a tremendous supplement and nutritional advance for you and the people you know, and a bit about the vision behind the technology. I know you want to hear a little bit about my story, so let me just start off with that. So I started medical school when I was 14 years old, and as you heard, I graduated when I was 17 from Mount Sinai in New York, and I became the world's youngest doctor at that time. I knew when I graduated that I did not want that to be the best thing I ever did. I did not want that to be my capstone. Instead, I wanted it to be the first step on a journey of making a difference. And I also knew that everything I did and was due to my family. So I just want to take a moment to recognize my mother, my father, my brother, without whom I would not be here, without whom I would be nothing. So thanks, and all of us should really thank our family. So thank you. So I'd like you all, just for a few seconds, if you can please close your eyes. Everyone in the room, just close your eyes, just for a minute. Please go ahead and close your eyes. Imagine if this is how you lived every day, and how you had to interact with your friends, your family, how you had to eat, how you had to cook, how you had to go to the bathroom. Imagine if this was your life every single day. You can open your eyes now. That's how 39 million people are in the world, blind in both eyes. That's 3 times the population of Paris, blind in both eyes. Almost 300 million people, almost the population of the United States, has some degree of decreased in vision. And you can imagine vision is the most precious sense, and yet 3 times the population of Paris is blind in both eyes. It's a tragedy that is 90% preventable or treatable or curable. We all want normal vision where we can see our friends, our family, see to do our job. And normal vision relies on our eyes being good. When you sit down at a restaurant and you're with someone you love, and you see their eyes sparkle, it's the cornea that's sparkling. The cornea is the front window of the eye, and it's a window not just to the soul, but also to the retina, the back of the eye. And the reason this is so important is, for us as physicians, we're using the retina. This is what the normal back of the eye looks like. This is the only part of the body that we can see nerve tissue and blood vessel tissue. Nowhere else can we see nerves and blood vessels. And so the eye is a window not just to your soul, but also to your health. The eye is a sentinel of diseases like diabetes and hypertension and lupus and many other conditions. We can observe a lot about a patient from looking inside the eye. You need the front of the eye, the cornea, which is the window, the retina, the optic nerve. All of those parts of the eye work together like a camera. I know no one in this room is old enough to remember a film camera, right? Everyone is used to taking pictures with their phone. But the eye very much works like a film camera, where the back of the eye is like the film that sends the vision to the brain. And two common causes of decreased vision, the two leading causes of blindness around the world, are macular degeneration and cataract. Many of you probably have parents or grandparents with cataract or macular degeneration. And let's take the first one, macular degeneration, where in the very center of the retina, the center of the film in the back of the eye, those cells slowly die. And what that looks like in a patient, when we look inside the back of the eye, is this. You have lots of bleeding in the center of the retina. Imagine how bad that would be for your vision. And this causes loss of sight in the center of your vision. So a patient with macular degeneration, they're seeing this. They can't see the center. And you can understand why this person couldn't drive, couldn't do their job. And how do we treat patients with macular degeneration? The current treatment for macular degeneration, this is the best that I as an eye doctor or my colleagues as an eye doctor can do. This is the best that we can do right now, is to stick needles inside the eye to deliver medication every month indefinitely. How many of you would like a needle inside your eye? I don't see any hands going up, so I didn't think that would be the case. Now, in the last 10 years, we've learned a lot about how nutrition can affect macular degeneration. We've learned about the importance of adding dark green leafy vegetables to our diet, of antioxidants to reduce oxidative stress in the eye, of how B vitamin deficiencies or vitamin D deficiency can increase the risk of macular degeneration. So there's a whole number of supplements already on the market that you've probably heard about, eye caps, Ocuvite, Preservision. All of those are perfectly good supplements, but as Dr. Saucedo will explain to you, just taking the supplement is not sufficient. We need to get the supplement inside our bloodstream, inside our body. Because you're not just what you eat, you're what you absorb. And that's where the technology behind Prodigy-5 enables the nutrients in it to get into our body. So Prodigy-5 contains those same nutrients, lutein, zeaxanthin, copper, and zinc, that were shown in two big clinical trials, AREDS-1, Age-Related Eye Disease Study 1, and AREDS-2, to slow the progression of AMD, to slow the progression of macular degeneration. And unlike any of the other supplements that I mentioned, in addition to the AREDS formulation, Prodigy-5 has the B vitamins, vitamin B6, vitamin B12, folic acid, which in the women's antioxidant study were shown to reduce the risk of development of macular degeneration. So not only is it preventing progression of macular degeneration, it prevents the onset of macular degeneration. And it prevents advanced loss of tissue in macular degeneration. Now, in addition to taking nutritional supplements, I think it's advisable to tell everyone who takes Prodigy-5 and people in general to cut back and try to quit smoking, to treat their blood pressure, to take care of their general health, because all of those things are important in addition to taking a nutritional supplement. So that's the macular degeneration story. And I'm focusing on vision because I'm an ophthalmologist. I take care of eye disease and eye surgery. And because the eye, as we noted, is a sentinel, is a marker for general health. And in addition to macular degeneration, another common condition is cataract, where the lens in the front of the eye, the part of the eye that helps focus light, the lens becomes yellow and cloudy. And this is what a cataract looks like inside a patient. You can see the browning of the cataract and why that would decrease the vision. If you go to the Louvre in Paris and you look at the work of Monet or Matisse, over the years when they were young, the paintings of Monet and Matisse were very vivid, very bright. And if you look at their later artwork, when they got cataract, their paintings became much more brown, much darker, because the light wasn't getting into their eye. So a cataract, what it does to the vision is make everything blurry, yellowed, browned, faded newspaper type vision. Things that can make cataract worse, if you live long enough, you will get a cataract. It's like gray hair. But in addition, smoking makes cataract worse, and insufficient vitamins C and E can make cataract worse. Those are antioxidants which are in Prodigy-5. The vitamins C and E in Prodigy-5 are the exact same doses used in 3 different clinical trials which have been shown to reduce the development of cataract. So what I'm trying to share with you is that the science of the doses of the ingredients in Prodigy-5 are based on multiple, not just observation studies, but multiple interventional clinical trials. This is one of the highest levels of evidence that we have. And so it's designed to reduce the risk of 2 of the major causes of blindness around the world, macular degeneration and cataract. But because of that, it also will help general health with other conditions, diabetes, hypertension, and so on. So with that, I'd like to say merci, dankeschön, spasiba, gracias. Thank you all so very much. It's been a true honor to spend time with you. Thank you. Dr. Saucedo is going to be coming out, and he's going to talk about general health and how the technology of absorption improves all of the supplements as well as some of the other antioxidant components. Thank you.
Thank you.